Hi, welcome to today's podcast, which is on physical activity and the role it plays in helping to prevent or delay type 2 diabetes. And I'm Serene Brooks, and I am the owner and educator at Goal Nutrition and Diabetes Specialty. I'm a registered dietitian and a certified diabetes care and education specialist. And I love helping to provide education for people so that they can be empowered to make decisions that will better their health outcomes. So today, the things we're going to talk about are really important if you are at risk for type 2 diabetes or have been diagnosed with prediabetes. This information will help give you a good start on developing some habits and understanding why it's important to be physically active in order to prevent type 2 diabetes. Prediabetes means your blood sugar levels are higher than normal, but not high enough to be diagnosed with type 2 diabetes. And either you've had an A1C test that shows you have prediabetes, maybe the doctor has told you you have prediabetes, or maybe you just have a family member who has type 2 diabetes, a close family member, such as a parent, sibling, or maybe several generations of people who have had type 2 diabetes, then you know you are more at risk for getting type 2 diabetes. There's lots of other risk factors that come into play with type 2, and that is having a really low activity level, being overweight. Maybe you need to lose some weight and you aren't very active right now. So that could put you more at risk for type 2 diabetes. Also, as we age, we get more at risk for type 2 diabetes. So there could be a lot of reasons why you're concerned about being at risk. So this is the time to start right now to find ways to prevent type 2 diabetes or lower that risk of getting it, delaying it any amount of time you can. Type 2 diabetes tends to be progressive in nature. So that means over time, regardless of management, it tends to progress. Now, the better the management, the slower the progression. So it's important to manage it if you have it, but any time you can spend without it is better because it does tend to progress a little bit regardless. And so we want to help you find strategies that will help you reduce the risk of getting it. It's really important to tailor this information to you and your specific needs and meet with a professional that can help you design a program for you or help you even with this part of being active so that it's safe for you, but it also fits your lifestyle and it accommodates your needs and helps you in the very best way it possibly can. Now, physical activity is not the only aspect of diabetes prevention. There are many, many things that impact the risk of type 2 diabetes. So once again, learning what all of those are and participating in some type of program to help you is really important because this is just the tip of the iceberg, but it's a really important part. So I want you to understand why physical activity is so important in diabetes prevention. First of all, I want you to kind of think about where you're at in being active right now and how often you're active. Maybe you have not been very active in the past and you're just getting started and you aren't sure where to start. Or maybe it seems overwhelming to know how much activity you need to get in. Well, the recommended amount of physical activity is 150 minutes a week of moderate activity. So that would be comparable to taking a brisk walk, which means you walk fast enough to elevate your heart rate, but you could still talk out loud or carry on a conversation with someone. So moderate. It doesn't mean you have to go for a walk. It just means that's the level of intensity you need to get to really see a benefit. For someone starting out, maybe a slow walk is going to give you that intensity, and that's okay. You'll find that over time, the more you're active, the faster you'll be able to go, and the more you'll be able to increase that intensity and still find that you could talk out loud without being out of breath. So just start where you're at, make it safe for you. Do whatever activity you love. Um, do things that fit into your lifestyle and into your schedule, but find something you enjoy doing that's active and set up a goal to be able to do that frequently throughout the week. Um, if it's an activity you love, you're going to be way more likely to do it and you'll be a lot more successful at it. Another thing with physical activity to help with success is to schedule it into your day. Set up times that you feel are most likely to be convenient for you or be able to give you the right amount of time to get some activity in. Now, maybe you don't feel like you have 20 or 30 minutes a day in one chunk, but you can divide that out. You can go for 10 minutes and then later on in the day do another 10 minutes and you've got your 20 minutes that day. So however you can do it to get 150 minutes a week at some point, that's what you want to build up to. That would be your goal. If you're already at 150 minutes a week, find ways to increase the intensity, increase the time spent, add in some strength training 2 to 3 days a week. Do something to increase that. Remember with strength training, it should only be every other day. You don't want it consecutive days. You need muscle repair time in between. So if you need to add something like that to help boost that up, then you can do that as well. But start where you are and make it something that's safe for you. Now, I want to talk about the role that physical activity directly plays in preventing type 2 diabetes. And for when you're active and you have any kind of muscle movement, you're helping your body use your insulin more efficiently. So, one thing about type 2 diabetes is someone with type 2 diabetes is resistant to the insulin they're already producing. And so we want to increase that sensitivity to the insulin to utilize your blood sugars better. When a person has pre-diabetes, it means they are starting to get a little resistant to the insulin they're producing. And just as some background information on what's happening with type 2, when a person eats any kind of carbohydrate, regardless of type 2 or anything else, just everyone in general, when they eat carbohydrates, the carbohydrates break down into a simple sugar called glucose. And that is what we use for an easy preferred energy source for our body function. It helps with any type of energy, not just energy to go and run and move, but energy for our brain to think properly and for our circulatory system to work and all our bodily functions to work. We need some energy source, and glucose is the preferred energy source, and it comes from carbohydrates. Now, you eat carbohydrates, it breaks down into glucose, goes in the bloodstream, but it can't leave the bloodstream without the help of insulin. For someone with type 2 diabetes, they're resistant to that insulin, and it takes more insulin in order to get that glucose out of the bloodstream and into the cells. And as you would know, if we can get the glucose out at appropriate levels, blood sugar levels would stay in a normal range. So if you're at risk for type 2 diabetes, if you have pre-diabetes, that means you're starting to become a little resistant to the insulin and your blood sugar levels are just starting to sneak up a little bit and getting a little bit high. So being active helps you become more sensitive to your insulin, which allows more glucose out of the bloodstream. A really important concept to understand why physical activity makes such a big impact on preventing type 2 diabetes. We want you to be able to use your insulin as efficiently as possible so that the glucose can get out of your bloodstream and be used how it is supposed to be used. Now, if you're active periodically throughout the week and spread it out over time, you're going to see a better benefit than if you lump all of your physical activity minutes into 1 or 2 days a week, because that leaves a few other days where the effects of that activity are no longer there. So having something each day or 5 days a week, if possible, is better than just a couple days a week. So find ways to get out and get moving. It's a really big part of preventing type 2, and you will see an impact on your blood sugars. That's one of the pieces to help them to be lowered and get you back in a normal range, which is what we want to prevent type 2 diabetes. Now, some other benefits of physical activity, especially when it comes to preventing type 2 diabetes, is it helps with the weight loss. Just a small amount of weight loss, about 5%, has been shown to help prevent type 2 diabetes. So figuring out how much weight you want to lose is important, but just remembering that physical activity, it helps burn calories and it helps build muscle. And both of those things contribute to weight loss, which in turn helps with preventing type 2 diabetes. Also, chronic disease prevention. I can't even tell you how important physical activity is to preventing any kind of chronic disease or even managing. Maybe you already have some type of chronic condition that you're dealing with. Physical activity can help you deal with it better, help you manage it better. Being active helps with heart disease. It helps prevent um, type 2 diabetes. It helps with weight maintenance. And it also can lower blood pressure and cholesterol, which is a really important part of having better outcomes over time. So getting active can help with also mental health issues. So depression, anxiety, things like that. It can help unwind you and help you feel better. Mental clarity is another benefit. Also, it helps you sleep better, and good having a good night's rest can also directly impact the risk for type 2 diabetes. And then it's also been shown to help make a positive impact on preventing dementia. So think of the mental health issues that can be have a benefit on with being physically active. Now, I mentioned improved sleep, finding ways to sleep better at night. Typically, when we're active during the day, we will have a better night's rest. Maybe you will wake up less frequently during the night. Maybe you'll be able to wake up and fall right back to sleep or have a more sound sleep, but it helps improve that sleep. Also, stress relief. It can help with not only relieving stress, but helping prevent it. If you're in the habit of being active and having a regular routine um, schedule of being active, having things that you love to do, being active, even just finding other simple ways to get moving, you're going to tend to have less stress and anxiety in your life. So it's a little preventative on that as well. But when it comes to stress, one of the great things is to get out and go for a walk or a bike ride or a swim or play a sport, whatever it is you love to do, definitely plays a big role in stress relief. We talked about mental clarity already, but yes, it helps you think more clearly. You'll do much better throughout the day, through work, decision making, if you have been physically active on a regular basis. Um, Also, we talked about the blood glucose management piece. It is really important to have that physical activity in. And we all know that being active strengthens our muscles, right? Not only do we want to be stronger, but the impact it also makes on bone. We want our bone mass to not decrease as we age. And so having a lot of physical activity in our day can also help to decrease the bone loss that we get as we age. So that also helps us be stronger. Now, the more muscle, the better when it comes to weight loss also, because muscle is an active tissue. It's a lean tissue. It helps promote weight loss. Think of what muscle would look like compared to fat. So we either have lean tissue, right, or we have fat cells. And so think of the difference in the two and how you want to convert the fat cells into developing lean tissue, which is muscle. And being physically active can do that. So if you're at risk for type 2 diabetes and you want to know one way to lower your blood sugars, being active is one of the really important things you can do. Anytime you're doing anything extra, remind yourself that you are helping your body utilize your insulin better. That's what you're doing. Any opportunity you have to be a little more active, do it, because it is going to help you to lower blood sugars and decrease the risk of type 2 diabetes, which will then bring a lot more positive health outcomes down the road.